Hello everybody from the WNEP Digital Studio. I haven't done one of these Facebook Live updates in a little while, so I thought today would be a good day because today we are seeing some of the best numbers tracking coronavirus here in Pennsylvania that we have seen in months, 7 months to be exact. COVID cases are at their lowest, below 100 or below 1,000 for the first time since October 5th. We are seeing numbers trend down significantly across the state. So many positive signs. If you were out and about at all this weekend, you probably noticed more and more places you could go in and people aren't wearing masks. There are big differences that are happening in the front of COVID-19 here in Pennsylvania after those CDC changes and all the numbers that we're seeing. So I thought today would be a good day to get in the digital studio, break down a bunch of the numbers that we are seeing here in Pennsylvania and here in our area, just to give you an idea of where things stand as we track coronavirus. So let's get things started with, I just realized I have to, let me make sure. Yeah, here we go. So this is the new cases in Pennsylvania today, over the last 14 months or so, maybe a little bit more than 14 months, I guess, when we're going back to March. So this was that peak that we saw back in December and November. Today, for the first time since October 5th, the Department of Health reported lower than 1,000 new cases of COVID. That number is right around 800. So what we had is the peak back in December, a big dip back that we saw in February. There was the rise in March and April, and now we are on a pretty steep decline in the number of COVID cases being reported each day here across the state. And let's put all that in perspective for you. So we've been talking big numbers for months now. Cases more than 1,000 each day for months now. Sometimes cases up to 2, 3, 4, 5, 12,000 cases a day when we were back in December. So we've been getting some calls and emails. How is it possible that we're adding all these cases? Everyone in Pennsylvania must have COVID by now. Well, let's put it in perspective. The population of Pennsylvania is 12.8 million. Confirmed and probable COVID cases, according to the Department of Health, so far 1.18 million. So a little over 1 million cases here in Pennsylvania that have been confirmed or probable. That leaves the percent of the population here in Pennsylvania who got COVID at 9%. 9% of Pennsylvanians that had a positive test or lived with someone who had a positive test and got sick themselves. Now, we all know that probably more people than this had coronavirus at times that they couldn't get a test last spring or may have been asymptomatic. So it is likely that this number is higher. But we're certainly not in the case that everyone in the state got coronavirus, even though we're talking big numbers. 9% of Pennsylvania confirmed or probable cases according to the Department of Health. So let's take a look at the positivity rates. This is the percent of people with coronavirus, or percent of people that went for a test last week and had a positive result. These numbers have been going down significantly as well. And this is a way that you can kind of track the community spread that's out there. And just to give you some perspective, back in December, we were seeing percents that were up in the 20s. Now, these are the counties with the highest percents last week. Monroe at 10%, Columbia, Bradford also, Pike up near 10, Susquehanna at 9%, Wyoming, Schuylkill at 8, Luzerne and Lycoming at 7%. Just to put this in perspective, health experts, the Secretary of Health, the CDC, they put 5% at a threshold that's concerning. We have quite a few counties in our area that are now below that 5% threshold. Pennsylvania as a whole is now down almost to that 5%. So a great sign there when it comes to the positivity rate. Another good sign we're seeing, the number of people with COVID who are in hospitals across Pennsylvania. We had quite a peak, more than 6,000 COVID patients in the hospital back in the November-December timeframe. We saw another rise back in March and April, but that is coming down significantly too. We are now actually at the same level that we were at this dip back in March right now. So we're down to about 1,400 people that have COVID that are in hospitals across the state today. So big improvements on the hospitalization numbers too. Just to put this in perspective, the hospitalizations are the people that are getting the sickest of sick and require going to a hospital. most of this time period, it was only about 2% of people that had COVID at the time that were sick enough to go to the hospital. That doesn't mean that there weren't people at home that were pretty sick, not feeling very good, but their sickness didn't rise to the level that they needed to go to the hospital. If you know anyone who has COVID, or maybe know multiple people who had it over the past year and a half, the symptoms are all over the place. Some people describe it as barely having a cold. Other people got really sick. Some people got sick enough to go to the hospital. Huge range in the experience that people had from this. But positive sign here that the hospitalizations are going down. Very interestingly, this is tracking the COVID deaths per day here in Pennsylvania. So each one of these is the deaths that were reported that day and attributed to COVID, or people that died with COVID. So we were up at a peak back in December, right around Christmas time, with the deaths of around 250, a little less than that per day. That declined significantly back in January and February. And then remember how we saw this spike in hospitalizations? Remember that spike in cases that we saw the past couple months? That didn't materialize with COVID deaths. We saw just a little bump with this. Likely because those that are most vulnerable to dying with COVID are the elderly and those with underlying conditions. Those people, a vast majority of them, are vaccinated. So I think we saw the impact of the vaccinations here that we never really saw that spike in deaths. COVID deaths are also declining even after that little bump that we saw a couple weeks ago. Let's put COVID deaths in perspective too, because we've heard a lot about these big numbers. There's lots of news outlets that have loved to throw out their big numbers and not put any numbers in perspective. We've tried here to put numbers in perspective, and we've hoped that that's helped over the last year and a half. So in total, the Department of Health reports 26,000 COVID deaths in Pennsylvania. So when you take all of those who had confirmed cases of COVID, the percent of those who had it, it's 2% of them who passed away. Similar to the hospitalization numbers, but 2% of them. Now another thing that you can look at with this is that, as we said earlier, there's likely a lot more people that had COVID that never got tested. So chances are that 2% number is even less than that, because of all the people that aren't being counted that likely had COVID at some point. The percent of Pennsylvania's population who died with COVID, 0.2%. That 26,000 is 0.2% of the statewide population. I just want to go back to deaths real quick and we've heard so much about COVID deaths, but it's very important to remember that this in perspective with, say, heart disease and cancer. Heart disease and cancer were still the top two causes of death in America over the past year. COVID was number 3rd. Heart disease was almost triple the amount of COVID deaths. So while there were quite a few deaths from coronavirus, remember there are many other things that we have to be concerned about. Heart disease by far was more concerning over the past year and over decades than coronavirus was. And unfortunately, we did see last year, early in the pandemic, a lot of people that weren't getting the necessary tests because they were afraid of going to hospitals and stuff. So a lot of that's resuming the important testing that we have on other ailments. So this is the look at the week-to-week trends. This is the data from last week here in Pennsylvania. There were 4,800 fewer cases reported last week than the week before. The positivity rate, as I said, the percent of people getting a test, testing positive, down 6.6% to 5.3%. Incidence rate is the number of people testing positive per 100,000 people. So that was 112 the week before, down to 74. We hadn't been below 100 in months at the incidence rate. Hospitalizations, 372 fewer this week. We're already down a couple hundred from Friday, so the hospitalizations are declining very quickly. Let's break down county by county now. We've gone through kind of the statewide of all the different positive signs we're seeing statewide and this rapid decline in the number of cases. We're seeing it also in a lot of our counties. Luzerne County is our most populated county, quite a bit bigger than most of our other counties. It had the spike around Christmas like everywhere else. This was the recent rise. It is going down rather quickly. Now it's averaging around 50 or so cases a day, much different than when it was averaging around 300 cases a day. It's been below 100 now for more than 2 weeks now. So big promising signs in Luzerne County. We've heard people say, oh, Luzerne's the worst because we hear it has the most every day. That's not necessarily the case because Luzerne has the biggest population. So it may have the most, but it should have the most based on the size of the population. But Luzerne has been going down. Lackawanna, really steep decline we're seeing in Lackawanna County since its most recent rise back in the middle of April. It peaked. Lackawanna County, it's been, I think, 10 cases or so today, down to a very small amount, especially for a county with 200-some thousand people. When you're talking 10 cases a day, that's a very low number. That was Lackawanna the past couple days. Monroe County this spring saw a peak almost as high as its peak back around Christmas. It is in another steep decline in the new cases being reported every day in Monroe. Schuylkill's kind of a slower decline there, but it's also at a much lower level than what it was back in the spring. It's still averaging around 25 cases a day, so it's relatively lower than what it was seeing when it was back up near 150. Northumberland County, same thing, leveled off a little bit, never really had the rise that it saw back before here in the spring. Lycoming County, a little bit of a rise here. It's leveled off some. It had actually, I think, 0 or 1 new cases today, so a big, that hasn't happened in months, so a big day in Lycoming County. Bradford County, it's seen some spikes, saw a big spike this spring up kind of near what it was seeing around Christmas. It's leveled off, but a little bit of a rise recently in trends in Bradford County. And so that's the situation with some of these counties that we have here. So overall, though, promising signs in just about all of our counties. So let's move on now to the vaccination situation here in Pennsylvania. And we're going to start with Pennsylvania adults 18 and older with the vaccination numbers. Of course, now those under 18 can get vaccinations now that the CDC has allowed the Pfizer vaccine for those 12 and up. Why are we just focusing on adults 18 and older? Well, the governor has set a standard for when those who are unvaccinated can take their masks off indoors, and that is 70% of adults fully vaccinated. Of course, the CDC has said that the fully vaccinated Americans can now take their masks off in most situations, indoors and out. The governor is holding off on unvaccinated Americans being able to do that, or Pennsylvanians being able to do that, until this number is up to 70%. Right now, 49% of adults in Pennsylvania are fully vaccinated. Now, we probably will get close to that 70% number based on what we're seeing here. This is the number with at least one shot, 67%. So you have to figure if you have at least one shot, chances are within the next month or so, you're going to be going back for your second dose. If we get that, that means about a month from now, we should see this be about the same as 67%. So let's check back in about a month, mid-June, and we'll see if we're getting towards that 70% threshold that the governor has set. Now, when it comes to wearing masks, I know that we're seeing a whole range of situations around our viewing area. There's a lot of places where people haven't been wearing masks for a while, or maybe not that everyone hasn't been wearing masks, but it's a huge range. And so these standards are what the governor has set. Of course, what's happening in reality can be a different story. But we have seen a lot of the places over the weekend, though, relax those mask standards for the fully vaccinated, following what the CDC said. Let's move on now to vaccinations per day in Pennsylvania. This was showing us how the number of people getting the vaccine was declining in recent months. And that has been an issue, that we're seeing less and less interest in getting the vaccine. A lot of these vaccinations per day has been second dose vaccines, which means that we're not growing the number of people getting the vaccine much at all. We did see a little bit of a rise last week, and that might be attributable to the fact that kids now the 12 and up can get the vaccine, but the data wasn't breaking that down by age. So we saw a little bit leveling off of that decline we were seeing in the interest in getting the vaccine. But this was last week. The total shots we saw all of last week was 493,000 across Pennsylvania. That was around 80,000 fewer than the week before. First dose is 203,000, second dose is 289,000. That shows that the first doses are less than the second doses. That shows that decline is likely to continue, but we will keep an eye on that now that more are eligible, and we'll see what happens with that. This is an interesting stat that we talked about, that the death numbers never really rose as much this time as they did last time. Well, the seniors are by far the most vulnerable. A huge majority of those COVID deaths came in people over 65. I don't have the number off the top of my head, but it was more than 90% of all COVID deaths were people older than 65. Now we have 96% of Pennsylvanians who are 65 and older who have at least one shot of the vaccine. 75% of senior citizens in Pennsylvania are fully vaccinated now. This 96% now is top 10 in the U.S. of seniors that have at least one shot of the vaccine. And of course, Pennsylvania has a lot of older people. Our population is older than most other states. So that is a big stat. And I think we did see some of the results of that. And in fact, in May, the senior citizens testing positive for COVID was at its lowest amount that we've seen through the pandemic. And some of the younger age groups were a little bit higher than that. And I would imagine these vaccination numbers are what are contributing to that. So that is our update on coronavirus here in Pennsylvania right now, with the cases, with the hospitalizations, the deaths, and of course the vaccine numbers. So we're seeing so many promising signs out there, and I know we were all kind of waiting for these days to come and hoping that these days would come and then we'll see this decline continue. We'll keep watching and we'll see what happens from here. But last year when we got to this point, we did see the cases go down, and we saw that throughout most of the summer. So let's hope that continues, and let's hope this year we don't see the rise in the fall like we saw last year. We're getting back to normal, and it sure is nice to see that. So I hope this helped. I find that every day through the pandemic, looking at all these numbers has certainly helped me. So I hope it helps you when we break it down like this too. So you all have a great day. Enjoy the beautiful weather that we're getting, and we'll be back with more updates when we have them for you. See you later. Bye now.